Our mission of improving healthcare through accreditation resonates daily through our staff, through our board members, and ultimately at the end of the day through our patients. We are sponsored by 37 different medical societies that help us write standards for quality imaging and quality therapeutic procedures. And we accredit facilities based on their compliance with the standards that we have written. We make them broad enough that we think everybody that's interested in improving the quality of what they do can meet those standards. So our focus is on helping our customers meet the standards and demonstrate their compliance to the standards, because at the end of the day, it's all about the patient. If the patient doesn't have the right imaging study at the right time, he likely is not going to get the right diagnosis and the right treatment.
You know, I want to operate at a high level. Accreditation tells me that I'm doing that because I'm judged by peers in my industry who are highly respected and say, this is what you need to do to do a great job. Your lab has done that. For me, that was awesome.
One of the things that Accreditation does that I think is probably one of the most difficult for us, but it's been the most helpful really in a lot of ways, is the QA meetings. The thing that we found that was so interesting is an open dialogue across with the physicians and the sonographers about what we wanted to see and exactly where we needed to be with something. If we're going to incorporate a new technology, how are we going to do it? When are the docs going to start interpreting it? How is, what's going to be the playing field for the interpretation? What's our report going to look like so it's all consistent?
I personally think it's been a great help to our lab to maintain quality, improve quality, because each accreditation process we find new things, different things that we should be doing.
The IAC accreditation is an essential element in quality vascular testing.
We are the only accredited facility around 150 miles radius accredited in neurologic, cardiac, and neurologic PET. It was a happy day, not only for our staff, but for our community.
The big accomplishment was when we diversified and went with other labs. And then we got accredited again with the addition of 6 other labs. That was a little bit more exciting, because then you get all the certificates and everybody's doing the right thing and you feel proud because you've accomplished this.
When I got my first certificate, it was framed. If I could have put it in a gold frame, I probably would have, but because the amount of work you did, you were like, wow, I did it. I think I emailed everybody in administration, we did it, we did it. And now I have a wall of all the certificates in my office, and I have them all framed. And it's just wonderful when the staff comes in for a meeting, they see that, and they take pride in that. I take pride in that. It's just a wonderful, and it's such a small thing, a certificate. But you'd be surprised the effect that it has to know, I did this, we did this as a team, and we put all this together.
Our mission is to improve healthcare through accreditation. And this is why. It's not just one more hurdle to get through. It's not just one more bureaucratic imposition by some third party somewhere, but it's actually an honest and sincere effort towards improving what we do. And I think that as professionals, that's one of the hallmarks of being able to be called a professional. It's not just what you do, but it's how do you find ways to do it better.